Welcome. In this video we are going to discuss about the delayed effects of radiation. Delayed effects of radiation means it refers to long-term health consequences that can develop after exposure to ionizing radiations. These delayed effects are generally categorized into stochastic effects and deterministic effects based on type of damage and the dose received. Let us see what is stochastic effects. Stochastic effects are also called as random effects. Stochastic effects are health effects that occur by chance, and the probability of these effects occurring increases with the dose of radiation, but the severity is not dose dependent. In other words, even a small dose of radiation carries some risk of these effects, and there is no threshold below which the risk is zero. What are the characteristics of the stochastic effects? The probability increases with dose, but the severity does not depend on the amount of radiation received. The main stochastic effects are cancer and genetic mutations. Radiation can damage the DNA in cells, leading to mutations that may cause the cells to become cancerous, and these mutations may accumulate over time and eventually leading to cancers such as leukemia, thyroid cancer, or other solid tumors. Genetic mutations. If radiation induces mutations in the germ cells, for example sperm or eggs, these mutations can be passed on to offsprings, leading to hereditary genetic disorders. The common stochastic effects are cancer, genetic mutations. In cancer, leukemia, thyroid cancer, breast cancer, lung cancer, skin cancer, and various other malignancies. Genetic mutations, radiation induced mutations can be inherited, but the risk is relatively low compared to overall cancer risk. For example, a person exposed to a low dose of radiation over a prolonged period, such as an occupational worker or a person living in a high radiation environment, may have a slightly higher lifetime risk of developing cancer, but the severity of the cancer is not related to the dose. Let us see the deterministic effects, that is non-random effects. Deterministic effects are also known as non-stochastic effects. So, those in which the severity of the effect increases with dose of radiation. Here it depends upon dose, and these effects have a threshold below which no effect occur, and above this threshold the severity of the effect worsen. So, let us see the characteristics of the deterministic effects. The severity of the effect is dose dependent. First one is it is purely dose dependent, and these effects are predictable based on the dose and the type of radiation, and there is typically a threshold dose below which no effect occurs, that is for lower dose there won't be any effects. And acute effects such as radiation burns, cataracts, and radiation induced tissues damage are often considered deterministics, and they can also manifest in the long term. Let us see some common deterministic effects. Skin damages, that means radiation burns, cataract, clouding of the lens in the eye, fibrosis, scar tissue formation in the organs and tissues, organ dysfunctions due to damage to organs like lungs, hearts, or kidneys, and sterility in both males and females, thyroid damage. This includes conditions like hypothyroidism due to thyroid tissue damage from radiation exposure. What are the late deterministic effects in different organs and tissues? For example, skin, it may cause radiation burns and skin cancer. Long-term exposure can cause chronic skin conditions like ulcers, pigmentation changes, and necrosis, cell death of skin tissues. And skin cancer is possible. Long-term effects can include an increased risk of skin cancer. Coming to eye, cataract formation. The lens of the eye is highly sensitive to radiation, and exposure to doses above 2 gray can cause cataracts. Next, let us have a look at lungs. In lungs, it causes pulmonary fibrosis, lung cancer. And coming to heart, for heart, cardiac dysfunction. This radiation can damage the heart tissues, leading to long-term conditions such as pericarditis, that is inflammation of heart's lining, coronary artery disease, heart failure, and often after doses greater than 30 gray. Thyroid issues, hypothyroidism and thyroid cancer. High doses of radiation to the thyroid gland can cause hypothyroidism and lead to thyroid cancer, especially in childhood radiation exposures. Then bone marrow and blood. Aplastic anemia. Radiation exposure that damages the bone marrow may result in insufficient production of blood cells, leading to anemia, immune deficiencies, and bleeding tendencies. Leukemia. While leukemia is also a stochastic effect, it may be considered deterministic at high doses due to its dose dependent occurrences. In breast tissues, breast cancer is possible. High doses of radiation to the chest, such as during certain cancer treatments or nuclear accidents, this increases the risk of breast cancer, especially in young women. Reproductive organs, infertility and sterility, that is high dose of radiation can lead to a permanent infertility in both men as well as women by damaging the ovaries and testes. Thank you for watching.